Besides problems with moving, there are other signs of mid-stage Parkinson's. These can include problems with pooping, peeing, blood pressure,
sleep and acting out dreams, being very tired, body feelings and pain,
skin, talking, thoughts, feelings, actions, sex, and family life.
There are some things our bodies do without needing to think about it. Pooping or having a bowel movement is one of them. But Parkinson's disease and the medicines needed for it almost always make it harder for you to go to the bathroom.
You may get backed up, where you're constipated for many days and your stool is hard and dry. Parkinson's medicines, pain medicines, and iron can make it worse. Not getting enough water or exercise and some foods can also make it worse.
This is a serious problem that needs to be treated. It can get in the way of your Parkinson's medicines working. There are lifestyle changes that can help. First, try to exercise and move more.
Remember, exercise is a form of treatment for Parkinson's disease. Walking, twisting from the hip, and stationary biking all help.
Eat more fiber and drink more water. Drink 6 to 8 glasses of liquid in the early part of the day. This helps you to go to the bathroom, but won't make you need to pee in the night. Stay away from caffeine and alcohol.
Meals should include fruits, vegetables, and whole grains. It helps to talk to a dietitian. Unfortunately, your health plan may not cover meeting with a dietitian. Sit down to go to the bathroom around the same time every day, usually within 30 minutes of your morning meal. Listen to your body. Don't ignore the urge to go.
You may want to put your feet on a footstool in front of the toilet. You can buy a squatty potty or find something like it. The slight change in body position can make it easier to poop.
Most people with Parkinson's have trouble peeing or urinating at some point. You may need to urinate often and right away. This can lead to accidents. Stopping to urinate throughout the day, even if you don't feel the urge, can help prevent accidents.
Needing to urinate many times at night can get in the way of sleep.
To help with this, don't drink fluids after 5 or 6 p.m. Stay away from caffeine and alcohol, which both make you pee.
Sometimes medicines can help lower the need to urinate. It may be worth visiting your doctor or urologist to go over your options.
For men, an enlarged prostate can cause problems urinating. Certain types of drugs, as well as surgery, may help.
Orthostatic hypotension is a big drop in blood pressure when you stand up. Usually, when someone stands up, there is a drop, but the nervous system gets it back to normal quickly. Parkinson's affects the nerves that control blood pressure, so they don't work quickly enough.
If blood pressure stays too low for too long, the brain doesn't get enough blood and you can faint. This can be dangerous because you can get hurt from falling down.
Orthostatic hypotension is common in Parkinson's because of the disease and the medicines used to treat it.
Most Parkinson's drugs lower blood pressure.
Have all your drugs looked at by a pharmacist who specializes in medication therapy management, which is called MTM for short.
Better yet, have an MTM pharmacist on your care team. Even if you don't faint, low blood pressure can cause tiredness, confusion, and a general feeling of being unwell.
Dizziness is also common in Parkinson's. This can be because of blood pressure or from inner ear issues. It can also be from something that happens in Parkinson's that we don't understand yet.
It is important to check your blood pressure and heart rate if you feel these symptoms. Check blood pressure and heart rate after lying down or sitting for 3 to 5 minutes, then check after standing for 2 to 3 minutes.
A common mistake is to check only when sitting down. The drop in pressure takes as long as 3 minutes after standing to show up. Talk to your care team to learn the right way to check. Orthostatic hypotension can be treated with medicines and in other ways.
Sleep with the head of your bed up 6 to 8 inches. You can buy bed risers at many department and home improvement stores. Drink 6 to 8 glasses of water or other liquid in a day. Try not to drink in the evening.
Wear compression stockings. Put them on before getting out of bed in the morning and take them off when in bed for the night. Belly binders can also help. Drink salty fluids like V8 first thing in the morning, or drink Noon tablets dissolved in water.
Putting more salt in what you eat, drinking more caffeine, and drinking less alcohol are helpful. Be sure to talk to your doctor before you add salt or salty fluids. Put your feet up throughout the day. Eat 5 small meals a day instead of 3 big ones. Blood pressure is lowered after a large meal.
Don't take hot showers. Use hot tubs or saunas. and stay away from very hot places.
Problems with sleep are common in Parkinson's disease. These problems can affect both you and your bed partner. Without a good night's sleep, you have less energy for coping with life.
Different health problems and medicines other than Parkinson's disease can also affect sleep. There are two kinds of sleep problems common in Parkinson's: nighttime and daytime.
Nighttime problems include problems falling asleep and staying asleep, acting out dreams, restless legs, and stopping breathing.
Daytime problems are usually about being very sleepy during the day. You may have trouble falling asleep or staying asleep. Problems falling asleep can be because of many things.
There are many treatments for this common problem, including prescription and over-the-counter drugs, but many of them have side effects or don't work.
After ruling out lifestyle factors like caffeine, try melatonin. There are also many ways to treat sleep problems without drugs. You can listen to relaxing sounds or music.
Cognitive behavioral therapy, or CBT, may also work. CBT helps you find out why you have sleep problems. It can help you change bad sleep habits or how you think about sleep.
CBT can be done with a sleep therapist or from home by following an online program or workbook. mHealth Fairview Neurology Clinic has more resources for you.
You also may have problems staying asleep. It's unusual for someone with Parkinson's to sleep through the night for 8 hours. It's more common to have broken sleep cycles, waking many times during the night. Some wake up after only 2 or 3 hours. Others wake up after 4 hours. Off time can make it hard to move and get comfortable in bed. You may have painful cramping in your foot, toe, or leg.
You may wake up because you need to pee. You may wake up for no clear reason. Changes to your Parkinson's medicine may help with some of this. Things you do while you're sleeping can also affect your sleep. These include breathing stops or sleep apnea, moving your arms and legs around and acting out your dreams. Breathing stops are often missed until you do a sleep study.
Clues that you may be stopping breathing at night are snoring, having a headache in the morning, and feeling sleepy during the day. Acting out your dreams is called REM behavioral sleep disorder. You may talk, yell, punch, kick, sit up, jump from bed, flail your arms, and grab. This may cause you to hurt yourself or your bed partner.
If you have this problem, be sure there are no sharp objects near the bed you could harm yourself with. Think about getting a bed that's closer to the ground or putting extra pillows or padding to protect you or keep you from falling out of bed. Also, keep any guns unloaded and in a locked safe outside the bedroom.
You may be acting out your dreams many years before you know you have Parkinson's, or it may come after. Sometimes a sleep study tells you if you're doing this. You can treat by stopping the drugs that can cause it, by using melatonin, or both.
People with Parkinson's disease may also have restless leg syndrome. RLS is a problem that causes tingling, pulling, creeping, or painful feelings in the legs.
You usually feel it when lying down in bed or when seated for a long time. RLS most often happens in the evening, making it hard to fall asleep.
People with RLS have the urge to move their legs, and you may need to get up and walk during the night.
This restlessness and need to move will affect sleep. Part of RLS is your legs moving during sleep. This can affect your bed partner's sleep. It's hard to tell this apart from acting out dreams.
Sleepiness during the day is common with Parkinson's. This is usually because you have trouble sleeping at night. Parkinson's medicines, especially dopamine agonists and levodopa or other medicines, may also make you feel sleepy.
Daytime sleepiness gets worse as you get older. If you have daytime sleepiness and you drive, you're at a higher risk for a car accident. The first steps are doing things to help you sleep better and working with your doctor to reduce medicines that make you sleepy. Feeling very tired is common in Parkinson's disease. Sometimes it can feel as much as a state of mind as of the body. Almost half of people with Parkinson's feel this way. Tiredness can be because of moving more slowly, stiff muscles, feeling sad, or sleep problems. It's hard to treat. Medicine only works sometimes.
Like with all the other signs of Parkinson's, tell your doctor how long after you take your Parkinson's medicine that you feel tired. If tiredness is because of wearing off, then drug changes may help. Tiredness can have many causes. It can be because of other health problems and the medicines you take for those problems. Many drugs for blood pressure, allergy, seizure, pain, anxiety, and depression cause sleepiness. An MTM pharmacist can help figure this out. If you're not moving much or don't have things in your life that matter to you, you can feel very tired.
Not exercising makes all Parkinson's symptoms worse and actually makes you feel more tired. Try to get enough sleep each night and every night. Eat healthy foods with a lot of fiber and drink plenty of fluids so you can go to the bathroom.
Exercise often. Do exercises that make you breathe hard, exercises that build strength and stretching exercises. Keep your brain active.
Boredom often leads to tiredness. Light therapy can be useful for some. Use things like yoga or meditation to help you relax. Stay busy, but not too busy. Do harder tasks when movement is easier and medications are working well. Pace yourself. Stay away from alcohol, nicotine, and drugs. If you're depressed, get treatment.
Numbness and tingling in the hands, feet, arms, or legs is called paresthesia. It's like when a body part falls asleep after being in one position for too long. In Parkinson's disease, this usually happens on the side of your body where your symptoms first began. It means there's a problem with the nerves. This is called neuropathy.
There are many causes of neuropathy, including diabetes, not enough vitamin B12, and thyroid problems. Sometimes we use special nerve tests and blood work to see if that's what it is. These tests can help guide treatment.
People with Parkinson's disease do have pain. It could be because of Parkinson's, from cramping, frozen shoulder stiffness, not being able to move as much, dyskinesia, or getting hurt from a fall.
It could also be from a different health problem that's made worse by Parkinson's. Dystonia is often described as a Charlie horse that can last minutes to hours. These cramps happen most often in the legs and feet, but can be in other body parts. Having your foot or ankle turn in and get worse with walking can be an early sign of Parkinson's.
That's often the case in young onset Parkinson's. Some people report this to their doctor before they know they have Parkinson's. It can be because of the disease or a side effect of Parkinson's medicine.
As we've said about all the signs, try to notice how soon after you take the Parkinson's medicine you have the cramping. Your doctor may be able to change how much medicine you take, how often you take it, or even add a new medicine. Using massage, applying heat, gently stretching the body part, or doing all three can help. If you have toe curling and foot dystonia, make sure your shoes fit well.
Seborrheic dermatitis is a skin problem that comes with Parkinson's disease. It can appear in all skin areas, usually appears as oily, flaky, reddened skin over the eyebrows, forehead, and scalp.
For men, it may also be in the beard area. It can be itchy or painful to touch. If it's on your scalp, you could lose hair until it gets better. We don't know exactly what causes seborrheic dermatitis.
Your doctor may tell you to use creams or shampoos or steroids to treat it. You may need to see a skin doctor for treatment and to look for skin cancers.
People with Parkinson's are much more likely to get melanoma or skin cancer than the general population. It's important for you to have a total body skin check every year. Drenching sweats sometimes happen in people with Parkinson's. Often it's because of medicines wearing off. Be sure to notice how long after you take your medicine this happens. Also, taking lukewarm showers can help.
There are a lot of things that can cause speech problems in Parkinson's. You may have trouble speaking loud enough for others to hear. Your words may become garbled. The rhythm of your speech may change. This can be made worse by slowness in finding the words. Trouble speaking makes it harder to connect with others at work and at home. It can greatly affect your quality of life.
Problems making sounds can make the voice sound more soft and quiet. The tone of the voice changes. You may lose high and low pitches. As a result, the voice is closer to one tone. Often to the person with Parkinson's, their voice sounds just fine, but others can barely hear them. This lack of awareness not only affects their relationships, but it also makes it less likely they will get help.
Some people repeat part of a word in a stuttering way. It's like fascinating, that runaway train type of walking.
This slurring and fast speech pattern makes it hard to understand what's being said. This can be very frustrating for both the person and family. The person with Parkinson's can't make themselves understood, and the family can't understand them.
These changes come about because the muscles you use to speak become stiff and slow. If chest wall muscles become stiff, less air moves in and out of the lungs, so there's less airflow for the voice.
The main treatment is called Lee Silverman Voice Treatment. LSVT, or loud therapy. Research has shown LSVT improves quality of life and speech.
The therapy teaches you how to breathe slowly and deeply, training your voice like an opera singer. It helps if you still do the exercises even after therapy.